sir. Your glasses, sir.
Thank you. Pardon me.
I will ask that you please do kindly pardon me.
Dr. Charles Kujo. Please put your hands together for me. Dr. Lady, I'm so sorry that I have to take your partner off of you. Please do pardon me, sir. I'm in trouble, I know, sir. I'm in serious trouble, I know, sir. I know, sir. Please do pardon me.
So our seat was just there waiting. I should have known better. Pardon me, sir. Please put your hands together one more time for Dr. Charles. It's a good thing and not a bad thing.
This is so amazing, isn't it?
It's in West Africa.
All right, I rest my case. That is a good brother indeed and indeed. Please put your hands together for Dr. Charles. Ladies and gentlemen, we would like to call.
I bring to you felicitation and greetings from the Guild of Medical Directors, Nigeria. And I want to stand on all existing protocol. I want to particularly commend and thank our dear friend Dr. Wale for this wonderful gathering he's put together every year in the past 8 years. Please, let's give him a round of applause. I mean, every time I attend, I feel so proud that we can put this together and bring all health practitioners here to look for ways to improve healthcare on the West African coast. And I think our mandate is limited, and for that reason, we should be able to deliver more because we're really focusing on just one part of Africa. The theme for this meeting this time is financing healthcare in West Africa. And it couldn't have come at a better time because from the president of the nation to the Minister of Health of Nigeria to members in the private and public sector, this has become a theme for us to begin to look at ways that the private sector can participate more effectively in the building, maintenance, and running of private sector hospitals of world class. Now, this is the mandate that was given to a group of us 2 weeks ago, and we've begun meetings. And I think when the chairman of that group speaks tomorrow, he will share with you more of the ideas that are emanating from that group. So allow me to just speak briefly from the Guild of Medical Directors to say we know the 3 elements in good healthcare delivery. And those are access to healthcare, the cost of that healthcare, and the provision of qualitative healthcare in the amounts that are needed. I must say we're working hard to improve access. And I've heard it said that Lagos State should be commended, and I want to add my voice to that. That Lagos State indeed is doing a marvelous job of shining the way for the rest of the nation. Mr. Commissioner, congratulations. And please extend the same to His Excellency, the Governor of Lagos State. If Lagos State can do it, the rest of Nigeria should be able to do it. So we're looking at how to give patients the best in access, in quality, and affordable cost. And that is the main problem. What is affordable health care? And indeed, how do we provide the money for that affordable health care? And we're beginning to brainstorm on the options that are available to us. One of which, of course, is to allow the Senate, or in fact plead with the Senate and the House of Reps, to next time from now on bring the health budget to the level that was agreed at the Abuja Declaration right here in Nigeria a few years ago, that health should receive 15% of the national budget. As we speak, we all know health is receiving about 4.5% of the national budget. That is grossly inadequate. Therefore, if we could even move it to 10% of the national budget, there will, I believe, be enough funds to lend on to the private sector, who we now have recognized shoulders about 70% of the health needs of the Nigerian people. We also believe that insurance is another way to go. Major companies have come to Nigeria who are willing to help us with infrastructure, with equipment, etc. but they ask, how do you pay for it? And I believe we could pool together funds through insurance to make available funds for such purposes. And I believe that indeed the universal health coverage for Nigerians has come, and the right time is to do it now so that we have enough funding in the kitty to pay for the infrastructure, to pay for the equipment that the health sector needs. So, ladies and gentlemen, we will be sharing our views with you again tomorrow at the formal session for this theme, Financing Healthcare in West Africa. So on that note, I want to thank you for listening, and thank you one, thank you all.
Thank you very much, sir. The good thing is that I'm not a politician.
And the rest of them. But the beautiful thing you actually mentioned, sir, is the fact that all hands being on deck will obviously help us produce the kind of outcomes we need for the health sector. I imagine that health is just 4.5% of the budget. What about the 5,000 naira note? I think it's about 5.5% of the budget. It's 40 billion. It's more than some of that has been voted for some of the capital projects in this country. But anyway, as long as you and I know that we're only just trying to have a moment here, please do not quote me outside. Dr. Charles Kujo, the president of the Guild of Medical Doctors. Well, ladies and gentlemen, we are supposed to have a telecast all the way across the seas from India. Without taking too much of our time, we'd like to read the citation of
Have you written anything?
India was a health specialist in the Middle East and North Africa and East African regions. She hosted dialogue on health issues in Jordan and Morocco. At the IFC, India advised on hospital projects in Mexico, Vietnam, and South Africa, and was responsible for assessing due diligence the viability of several IFC potential investments in health and education in several countries in Middle East, Africa, and South Asia. In addition, Egbe also worked with both Allen and Hamilton on healthcare projects in the US and South Africa. Egbe has over 25 years' experience in the healthcare covering policy, provision, and healthcare financing in Africa, Asia, Europe, Middle East, and Latin America. She has also taught international health management and finance at several US universities. Please put your hands together for Dr. Egbe. And that is just part A of the citation. Part B. She is a qualified medical doctor and a member of the UK Royal College of Physicians, MRCP. She holds an MBA from Cranfield School of Management, an MSc from Oxford University, and MBBS from the University of Ibadan. She has authored several articles, contributed to books, and was the lead author of Establishing Private Healthcare Facility in Developing Countries, a guide for medical entrepreneurs, published by the World Bank in 2007, with Singh Hyun Nam. Egbe belongs to several professional organizations, including the Healthcare Business Women's Association, the American College of Physician Executives, and the Association of Nigerian Physicians in the Americas. Please put your hands together. You have to do that. She's also on the advisory board of Sprozil, which focuses on innovative applications of its mobile phone authentication technology, and the Mayo Clinic Center for Social Media. She was recently appointed to be a member of the Joint Steering Committee for Private Sector Development in Nigeria, and also a member of the Technical Committee for the African Development Bank e-Health Awards. Please put your hands together for her. She was also an expert reviewer for the health sector in the e-Transform African Study, a joint initiative by World Bank, Africa Development Bank, and Africa Union. And for this moment, she is my adopted senior sister. Ladies and gentlemen, please put your hands together for Dr. Egbe Osifo Dawoodi. And she's going to be presenting the special lecture titled Healthcare Financing Models yesterday, today, and tomorrow. Please put your hands together for her one more time. Please, the camera take this moment. It doesn't take all the time.
wonderful, wonderful introduction. I'm sure if anybody heard that, and my daughters and my mother heard that, would not know who you were talking about.